Bismillah ar-Rahman ar-Rahim, in the name of Allah, the most merciful, the most gracious. This is Ahmad Zahran speaking, and welcome to our lecture for today. And after having a quick introduction about the anatomy of the skull, today let's start our very first lecture and let's talk about the anatomy of the frontal bone of the skull. The frontal bone. It's that bone that is present here in front. In the forehead. It's the bone that's related to the forehead. And as I'm going to talk about each and every bone of the skull, we have to mention several information about every bone in the beginning. Is that bone related to the neurocranium or is it related to the visceral cranium? And if it was related to the neurocranium, is it a part of the clavaria of the skull or is it a part of the skull base? And let's start talking about the frontal bone. The first thing, the frontal bone. The frontal bone is present in here. This is the frontal bone, as you can see in this picture as well. What do you think? Is this frontal bone related to the neurocranium or the visceral cranium? Well, yes, it's related to the neurocranium. It's the anterior part of the neurocranium. Okay, so this is the first information I get about the frontal bone, that it is a part of the neurocranium. Okay. Is it related to the clavaria of the skull or related to the skull base? This is a very important information. The frontal bone shares in both. It's present in the clavaria. A part of the frontal bone is within the clavaria of the skull, and a part of the frontal bone is actually present here in the skull base. Okay. So I know now that the frontal bone, it's this bone that's present here in the forehead, and this bone is a part of the neurocranium, and this bone shares in both the clavaria of the skull, the anterior part of the clavaria of the skull, and as well in the anterior part of the skull base. And that is what we're going to study in details today. So, if you want to study the frontal bone, where exactly do you have to look at the skull? Where do you see the frontal bone from? Well, I can see it if I look at the skull from front. Yes. And I can see a part of it if I look at the skull from the sides. That's right. And I can see the frontal bone if I look at the skull from above. From the clavaria. And I also can see the frontal bone if I look at the skull base from inside. So we have 4 views in which we can study the frontal bone from anterior aspect of the skull, from the lateral aspect of the skull, from the superior aspect of the skull, and when we study the skull base or the anterior cranial fossa, we can also see here the frontal bone. Okay, how amazing is that? And let's start talking about the frontal bone as we look at it from front. Okay, so this is the frontal bone as I look at it from front. Okay, let's explain what we see. Let's just describe what we see. I think that from front I can see that this part is very flat in here. It's related to the clavaria of the skull. Until we go downwards, then we have, this is the orbit, this is the opening of the orbit, okay? So the frontal bone is apparent from here downwards till we reach the orbit. Yes, okay. But as we go downwards, the frontal bone is no longer flat. It's not flat as it is above in here. But there are some ridges that are present above the orbit. Like 2 arches in here above the orbit. And they are called the supraciliary arches. The supraciliary arches. They are arches or ridges of bone that are present above the orbit or above the eye, above the ciliary muscles. Okay, so the supraciliary arch, right and left supraciliary arches. And these arches or these ridges or these elevations that are present in the skull are actually due to the presence of the frontal air sinuses. There are types of nasal sinuses or paranasal sinuses that are present in here. They are gaps within the bone that are filled with air. They are called the paranasal sinuses, and we have two frontal air sinuses in here, one right and one left, and these air sinuses will form elevations in the anterior aspect of the skull that are related to the supraciliary arches. Well, actually, the supraciliary arches are larger in the male skull. The females, they have very small supraciliary arches, but the male skull, they have a very broad or very wide supraciliary arches. Okay, so this frontal bone from front, we can see that it's flat from here, and then we can see the supraciliary arches. Between the two supraciliary arches, there is a valley in here. We have a right supraciliary arch and the left supraciliary arch, two elevations between them. There is a valley in here. And this valley is called the glabella. The glabella of the frontal bone. So there are two supraciliary arches, and between them, this depression here is called the glabella. Okay, you can even see in this picture in here that there is a remnants of the metopic suture. What's the metopic suture? Well, actually, the frontal bone, we know that it's one of the unpaired bones, but sometimes it's not unpaired, it's a paired bone. And there is a suture between the two frontal bones, right and left. It's called the metopic suture, but this is not the case in all of the skulls. Most of the skulls, the frontal bone is just one unpaired bone, okay? So, now I know that if I look at the skull from front, I can see the frontal bone in here in the clavaria, and then this is so flat in here, then it goes downwards towards the orbit, and above the orbit we have two supraciliary arches, and between them this valley in here, or this depression in here, that is called the glabella. Okay, that is so much amazing. But if you look deeply here in the supraciliary arches, you can find that there is a small hole in here. Holes in the skull, we call them foramina. So this is called a foramen. This is called a foramen. It's a foramen that is present above the orbit. So let's call it the supraorbital foramen. How about that? Okay, how about that? The supraorbital foramen, the foramen that's present above the orbit. So it's the supraorbital foramen. Okay. Just medial to the supraorbital foramen, there is a small groove in here. Yeah. What is it called? We call it the supratrochlear notch. The supratrochlear notch. Okay, I'm just looking at the skull and describing what I'm seeing. So there is two supraciliary arches. Between them there is a glabella. Okay, and in the supraciliary arch I can see the supraorbital foramen and the supratrochlear notch. Well, actually, the supraorbital foramen, it passes two important structures. It passes a nerve and a vessel, and I know you know them very well. It passes the supraorbital nerve and the supraorbital artery. Okay. What is the origin of the supraorbital nerve? Okay. The supraorbital nerve was a branch of the frontal nerve of the ophthalmic nerve of trigeminal. Exactly, this is the supraorbital nerve. What about the supraorbital artery? Well, it's a terminal branch of the ophthalmic artery. How amazing is that? Okay, so this is the supraorbital nerve and vessels that pass through the supraorbital foramen. Okay, what about the supratrochlear notch? The same. Within the supratrochlear notch passes the supratrochlear nerve and vessel. The supratrochlear nerve is another terminal branch of the frontal nerve of ophthalmic of trigeminal nerve, and the supraorbital artery is a branch of the ophthalmic artery, or a terminal branch of the ophthalmic artery. How amazing is that? How amazing is that? So now I can see that I know a lot about the frontal bone from front. If you look at the skull from front in here, I can see that the skull is flat from above, related to the clavaria, and then as we go downwards towards the orbit, we have two supraciliary arches. Between them, there is a depression here that's called the glabella, and within the supraciliary arch, I can see the supratrochlear notch and the supraorbital foramen. Within them passes the supratrochlear and supraorbital nerves and vessels. Okay, how amazing is that? Okay, what else? What else you can see here if you look at the frontal bone from front? Okay, and as we go downwards in here, you'll find that the frontal bone just curves around the orbit in here, forming two protrusions around the orbit, a medial protrusion and a lateral protrusion. Okay. Let's call them processes. We have a medial process in here and a lateral process in here. But what are these processes going to do? They actually are going to fuse with other bones in the skull. This lateral process in here, it's called the zygomatic process of the frontal bone, and it's going to fuse with the zygomatic bone forming the frontozygomatic suture. Okay, and this medial process in here is going to curve medially here, going to reach the nasal bones in here. So it's going to be called the nasal process of the frontal bone. So we have the zygomatic process that fuses with the zygomatic bone, and the medial here we have the nasal process that is going to fuse with the two nasal bones medially in here, and even they fuse with the maxillary bones here laterally. So these are the two processes that are present here. If you look at the frontal bone just above or around the orbit, we have the lateral zygomatic process of the frontal bone that's going to fuse with the zygomatic bone, and we have the medial nasal process of the frontal bone that's going to fuse with the two nasal bones medially and even with the two maxillary bones laterally. So if I look at the skull from front, I can see that it's flat from here, from the clavaria, till we reach the two supraciliary arches. We can see the glabella in between, we can see supratrochlear notch, we can see the supraorbital foramen, and we can see the zygomatic process of the frontal bone and the nasal process of the frontal bone. How amazing is that? Is that it? Is everything that's related to the frontal bone? If I look at it from front, well, actually, no. If you look deeply here, after the supraciliary ridge, we just enter the orbit. We can find that the frontal bone shares in the roof of the orbit. This is related to the frontal bone in here. Okay, so this is the frontal bone. As you look at the orbit from inside, it forms the roof of the orbit. And within the orbit, the frontal bone, which forms the roof of the orbit, it also fuses with other bones that share in the orbit. What are they? Well, they share with the lacrimal bone, forming frontolacrimal suture. They share with the ethmoidal bone. A part of the ethmoidal bone is present inside and here, so they form the frontoethmoidal suture, and they even share with a part of the sphenoid bone, forming the frontosphenoid suture. Okay. So I know now that the frontal bone forms the roof of the orbital cavity, and as it forms the roof of the orbital cavity, it fuses with other bones that share in the formation of the orbital cavity. It fuses with the lacrimal bone, forming the frontolacrimal suture. It fuses with the ethmoidal bone, forming the frontoethmoidal suture, and even fuses with the sphenoidal bone, forming the frontosphenoidal suture. How amazing is that? I think I know now everything about the frontal bone. If I look at it from front, I know that from above it shares in the clavaria, so it's very flat in here, till it goes downwards. Above the orbit, we have the two supraciliary arches, and between them, this depression is called the glabella. I know the supraorbital foramen, the supratrochlear notch, and within them passes the supraorbital and supratrochlear nerves and vessels. I know that we have two processes downwards in here, one lateral zygomatic process of the frontal bone that fuses with the zygomatic bone through this frontozygomatic suture, and one medial nasal process of the frontal bone that fuses with the nasal bone medially and with the maxillary bone laterally. And I know that the frontal bone actually shares in the roof of the orbit, and here it fuses with three bones, forming frontolacrimal suture with the lacrimal bone, frontoethmoidal suture with the ethmoidal bone, and frontosphenoidal suture with the sphenoid bone. How amazing is that? And now you know everything about the frontal bone as you look at the skull from front. Okay, what's next? Let's turn the skull around and look at the skull from above. Okay, now what I can see just the clavaria. This is the clavaria of the skull. I see nothing else but the clavaria. Okay, so where's the frontal bone? Here. This is the frontal bone. Oh, taking so much area of the clavaria in here. Yes, this is the frontal bone. Okay, I can see that. The frontal bone is here, is fusing with two bones back here. What are these? They are called the parietal bones. So we have two parietal bones, and in front of them I can see that this is the frontal bone. Okay, and of course there is a suture that fuses the frontal bone with the two parietal bones. What is this suture called? It's called the coronal suture. It's like the skull is wearing a crown. Okay, so this is a coronal suture. It's the suture that fuses the frontal bone with the two parietal bones of the skull. But wait a minute. There is an important point in here you have to know very well. It's the point of fusion of the two parietal bones and the frontal bone. It's this point in here. This point is called the bregma. It's called the bregma here. This is the bregma. What's the bregma? It's the point of fusion of the two parietal bones with the frontal bone. Okay, the bregma. Well, actually, I have to tell you that this bregma was one day a hole or a fontanelle. Yes, okay, if you remember, when we know the skull of the baby, we know that there were holes when more than two bones fuse together or come close together. If there is a hole between them, there is a gap, which is a hole between them, and it's called a fontanelle. And here, this fontanelle is called the anterior fontanelle. The anterior fontanelle, it's the fontanelle that's present between the two parietal bones and the frontal bone. And when this anterior fontanelle is going to fuse, it's going to form a point of fusion here that is called the bregma. That's called the bregma. Okay, and this is what I have to know about the frontal bone from above, that this frontal bone forms the anterior part of the claviria, as I see it from above, and that it's fused posteriorly with two parietal bones. Between them is the coronal suture, and I know a very important point, the point of fusion of the two parietal bones and the frontal bone here, and this point is called the bregma, and this bregma was once the anterior fontanelle. Okay, how amazing is that? How amazing is that? Now I know the frontal bone as I look at the skull from front, and I know the frontal bone as I look at the skull from above. What's next? Let's look at the frontal bone from the sides. Okay, now we're going to turn the skull to the side and look at the frontal bone from the side. Well, I can see here actually that this is the frontal bone, okay? And behind it is the parietal bone, I know that very well. And even I can see here the coronal suture, yes, from the sides, I can see the coronal suture. That's nice, okay? But that's not it. Well, actually, the frontal bone is going to fuse here with another bone, which is a part of the sphenoid bone. Okay, the sphenoid bone, we can see it also from the lateral aspect of the skull. This is the part of the sphenoid bone, okay? And between the frontal bone and the sphenoid bone, of course, there is a fronto-sphenoidal suture. Actually, this suture is continuous within the orbit. I just mentioned it in the orbit, and this suture is continuous till you can see it in here in the lateral aspect of the skull, the fronto-sphenoidal suture. Okay, but actually in here, in this part, the frontal bone is going to fuse not just with the parietal bone and the sphenoidal bone. It also fuses with what? With the temporal bone. What? Yes, this temporal bone in here. This is the temporal bone. There is a point of fusion between four bones in this point. The frontal bone, the parietal bone, the sphenoidal bone, and the temporal bone. This point, a very important point in here, this is called the terion. The terion. Wait a minute, it's the point of fusion of more than one bone. So you want to tell me that this terion was once a fontanelle? Yes. Before it was called the anterolateral fontanelle, or sometimes we call it the sphenoidal fontanelle. When fused, it forms the point of the terion, in which four bones are going to meet together or fuse together. The frontal bone, the parietal bone, the temporal bone, and the sphenoidal bone. How amazing is that? And this is what we have to know about the frontal bone from lateral aspect. So this is the frontal bone as I look at it from the lateral aspect. This is the frontal bone. And I even can see the zygomatic process of the frontal bone from here as it fuses with the zygomatic bone, forming this frontozygomatic suture. I can see that behind the frontal bone there is the parietal bone, between them is the coronal suture. I can see that it's fusing with the sphenoidal bone, forming the frontosphenoidal suture. And I know now the point of the pterion, which was once the anterolateral fontanelle or the sphenoidal fontanelle. In this point, 4 bones are going to fuse together: the frontal bone, the parietal bone, the temporal bone, and the sphenoidal bone, and they all are fused within the point of the pterion. How amazing is that? Okay, I think that's it. If we look at the skull from outside, I can see the frontal bone from front, and I can see the frontal bone from above. I can see the frontal bone from lateral aspect. That's it. There is nothing else to be said about the frontal bone as I look at the skull from the outer aspect. So what's next? We're going to open the skull and look at the frontal bone from inside. If we start with the clavaria of the skull, you can see that if I look from inside, the frontal bone forms the anterior part of the clavaria from inside. And from back here, you can see the 2 parietal bones, and between them, of course, is the coronal suture. But there are some other features you can see within the clavaria from inside. There is a groove in here, in the midline. Yes, there is a groove that goes backwards from the frontal bone backwards to the parietal bones in here. This groove is called the groove for the superior sagittal sinus. The superior sagittal sinus, that was a dural venous sinus that was related to the medial longitudinal fissure of the brain. Yes, and it forms a groove in here. Didn't I mention that the skull was formed around its template, and the template was the internal structure? So the internal structure in here, a superior sagittal sinus forming a groove within the inner aspect of the skull, called the groove for the superior sagittal sinus. There is also an elevation here in front. It's called the frontal crest. Frontal crest, okay, so that's everything that's related to the frontal bone as you look at the clavaria from inside. This is the frontal bone forming most of the anterior aspect of the clavaria. Backwards, it's fusing with the 2 parietal bones by the coronal suture. Okay, and we know now that there is a groove for the superior sagittal sinus, and we know the frontal crest. Okay, what else? Let's look at the skull base. As you look at it from inside, the skull base is formed of the cranial fossae. We have 3 cranial fossae, 1 anterior cranial fossa from front. We have here the middle cranial fossa, and back here we have the posterior cranial fossa. Of course, I'm going to talk about the frontal bone, so it's related to the anterior cranial fossa. It actually forms, as you can see in this picture, forms most of the anterior cranial fossa. And this part of the anterior cranial fossa that is related to the frontal bone is called the orbital plate of the frontal bone. The orbital plate? Well, actually, yes. This orbital plate of the frontal bone, if you dig inside here, you will find yourself in the orbit. Didn't I mention that the frontal bone forms the roof of the orbital cavity? Yes. So if I dig in this roof from inside the orbit here, I will find myself in the anterior cranial fossa, as the frontal bone in here, which is the roof of the orbit, forms a major part of the anterior cranial fossa as the orbital plate of the frontal bone. You can actually see that this orbital plate is not just flat or straight, it actually have corrugations in here. And this is because there are orbital gyri in here. There are calcium gyri that form impressions on the inner aspect of the skull. Okay, so we have a template in here, that's the brain, forming an impression on the orbital plate of the frontal bone. You can also see that this orbital plate is fusing with 2 other bones in the anterior cranial fossa. Medially here it's fusing with the ethmoidal bone, a part of the ethmoidal bone, and back here it's fusing with a part of the sphenoidal bone, forming altogether the anterior cranial fossa. But the major part of the anterior cranial fossa is formed by the orbital plate of the frontal bone. 2 more things in here. This is the frontal crest as well, as I mentioned it before in the clavaria, in the anterior part of the clavaria. This is the frontal crest. Actually, the frontal crest gives attachment to the falx cerebri. The falx cerebri is attached anteriorly here to the frontal crest. And behind the frontal crest, you can see a small hole in here, just in front of the ethmoidal bone. This small hole in here, just one hole or one foramen, it's called the foramen cecum. The foramen cecum, okay? It's not the cecum of the large intestine. It's the foramen cecum, okay? It's another cecum in the body, okay? This is the foramen cecum here. The foramen cecum. This foramen cecum can be present in many skulls or cannot be present, okay? And if it's present, sometimes it passes a vein, small vein that we call an emissary vein. You have to hear this name, as we're going to mention it a lot in the future. Emissary veins or emissary veins. These veins are veins that communicate between intracranial veins and extracranial veins. So we have here an emissary vein that passes within foramen cecum, the foramen cecum. Okay, and that's everything we can mention about the frontal bone. If we look at the skull from the skull base, from inside, we know that it forms most of the anterior cranial fossa by the orbital plate of the frontal bone. It's fusing medially with the ethmoidal bone, fusing posteriorly with the sphenoidal bone, and we know here the frontal crest, which gives attachment to the falx cerebri, and we know the foramen cecum that sometimes passes an emissary vein. How amazing is that? I guess now I know everything that is related to the frontal bone from all aspects of the skull, and let's have a quick revision. So, the frontal bone is that bone that's present in the forehead and here. I can see it from many aspects. I can see it if I look at the skull from front, or from lateral aspect, or from superior aspect, or even if I look at the skull from inside. Okay, so this is the frontal bone. As you look at it from front, we can see here that from above it's so flat as it relates to the clavaria, and then as we go downwards we have two supraciliary arches above the orbit. Between them this depression here is called the glabella, and within the supraciliary arches we can see the supraorbital foramen and the supratrochlear notch, and within them passes the supraorbital and the supratrochlear nerves and vessels. Down here they curve around the orbit, forming two processes. Laterally, the zygomatic process of the frontal bone, which is going to fuse with the zygomatic bone, forming the frontozygomatic suture. And medially, we have the nasal process of the frontal bone, which fuses with the two nasal bones medially and with the maxillary bone laterally. But that's not it. If you look inside the orbit, you can find that the frontal bone forms the roof of the orbit, okay, and it fuses here with three bones, with the lacrimal bone forming the frontolacrimal suture, with the ethmoidal bone forming the frontoethmoidal suture, and with the sphenoid bone forming the frontosphenoidal suture. Okay, so this is the frontal bone as I look at it from front. If I look upwards in here, I can see that the frontal bone forms an anterior part of the clavaria of the skull. Behind it you can see two parietal bones. They are fused together here at the coronal suture, and we know this point in here, which is called the bragma, which once called the anterior fontanelle, which is the point of fusion between the frontal bone and the two parietal bones. Okay, and if I look at the skull from the lateral aspect, I can see that the frontal bone is in front in here. And you can see here the zygomatic process of the frontal bone, and as it fuses with the zygomatic bone forming the frontozygomatic suture. Here behind you can see the parietal bone and the coronal suture between them. And here you can see the sphenoidal bone from the lateral aspect, and between them is the frontosphenoidal suture. And we know the point of the pterion, which is the point of fusion of four bones. The frontal bone, the parietal bone, the temporal bone, and the sphenoidal bone. They all fuse at the point of the pterion, which was once called the anterolateral fontanelle or the sphenoidal fontanelle. Okay, and then I had to open the skull to look at the frontal bone from inside. If we look at the clavaria from inside, we can see that the frontal bone forms most of the anterior aspect of the clavaria, fusing posteriorly with the two parietal bones by the coronal suture. And we can see the groove for the superior sagittal sinus here in the midline. And in front in here, we can see a part of the frontal crest. Okay, and if I look at the skull base, I can see that the frontal bone forms most of the anterior cranial fossa by the orbital plates of the frontal bone, which fuses medially here with the ethmoidal bone and fuses posteriorly with the sphenoidal bone. I can also see here the frontal crest, or the remnants of the frontal crest, which gives attachment to the superior sagittal sinus, and behind it there is a small foramen in here, which is called the foramen cecum, which sometimes passes an emissary vein. Okay, thank you very much. That is everything I can say about the frontal bone. I hope you do understand it. This was the first bone of the skull, the frontal bone. I hope you do understand it. In the next lecture, inshallah, we're going to talk about the parietal bone of the skull. Don't forget to subscribe to our channel and become a member of Neuroanatomy in English playlist. See you next lecture. This is Ahmad Zahran.